need 3 things. The first one is a towel. So when you place your thumb and index finger together, it makes a circle. The towel should be able to fit right inside. Second thing you're going to grab is a ball. It could be any ball, tennis ball, whatever you have around the house. And then finally, an elastic, like an exercise band. When we're talking about alleviating sciatic pain, we have a couple areas to look at. So first, grab your towel, lay on your back, and place the towel right in the middle over top of your tailbone. So just walk your heels out and let your knees fall inwards, almost as if they're kissing towards each other. And then you're going to just gently squeeze the outer parts of your hip inwards. Now, this is not an incredible pressure. This is just enough pressure that you're thinking that you're just putting a little millimeter of force. This is going to help release the tailbone and the back. So just a quick little bit of anatomy here. When we're speaking about sciatic nerve pain, oftentimes this is pain that we feel down the back of our leg that doesn't go below our knee. If the pain does not go below the knee, this is definitely a good video for you, because we're going to be releasing all the muscles and areas that may be causing what's known as piriformis syndrome, which is when that piriformis muscle is so tight that is what's creating tension on the sciatic nerve and giving you that numbness, tingling, or burning going down the back of your leg, but not lower than the knee. If the pain is lower than the knee, then we might suspect something like a disc injury. However, that can only be confirmed through an MRI or X-ray or imaging of that nature. In that case, I'm going to leave the link below to another video that you can follow that helps with different exercises to treat a protrusion. Ultimately, going to see a healthcare professional would be your best choice in this case. So in a few moments, we're going to walk our heels back towards each other. And whenever you're ready, slowly recover, lift the towel from underneath you, and you're going to roll on to your stomach. You can place your forehead on your hands, bend your knees, and you're just going to open and close your legs. So first we're going to let them fall to the side, and then we're going to cross our ankles over. So what we're doing here is we're moving that femur bone, that thigh bone, which is creating a movement at those hip bones, the innominate bones, right at the SI joint. And this is what we're going to help to mobilize here. It's also a great technique to help just to pump and work that piriformis muscle, just to bring blood flow to the area and to prepare this area for the work that we are going to do. So just keep moving your feet back and forth. And out. And in. And out. Really try to relax and let your feet fall right out to the side. And in. Let them fall in as much as they can. Out. In. And down. We'll roll onto our back again. And this time we're going to get the tennis ball or whatever ball that you have. So you're going to find those pointy, bony parts on the side of your hip, line it up right above, and then you're going to chase the line back right beside your tailbone. So not on top, right beside. Then you're going to use your other hand to place right underneath the tailbone so that it's not too much pressure. Straighten out the opposite leg and keep the knee bent to the side that we're working on. So let that bent leg gently fall out towards the side a little more every few seconds. You can place a couple pillows or a few pillows right underneath the knee here if you're scared you won't be able to bring your knee back up for any reason, and recover. And let it fall out again and recover. We're going to pick up the pace a little bit here. and recover and out. And I'm also over crossing my legs, so I'm not bringing it back completely to neutral. I'm also letting it fall inwards as well when I recover from this outward position. Out. And now just let it relax as you're holding your knee out towards the floor. And recover back, and we're going to move the ball a little bit a ways towards that pointy part of the hip. Same thing, gently let the leg fall out, letting it fall out more and more every few seconds. And let it recover back up. And now back and forth and in. So I'm not coming over as much over the middle this time because it doesn't feel that I need to. But if for you crossing over the midline feels better for the release, then you can do that. And again, slide the ball a little bit more towards that pointy part of your hip, or the bony part of your hip rather. And keep letting your leg fall out to the side. And let your leg fall again. A little bit more. A little bit more. And a little bit more. And now back and forth. Back to the center and out. Back to the center and out. And just continue that pace. Make sure to breathe. And we're going to move the ball a little bit more. Should be right behind that bony part of the side of your knee. And now just let your leg rest out to the side here. And just pulse it. 2, 3, 4, 5, 6, 7. We'll remove the ball. We're just going to stretch those muscles out that we just worked on. So first, cross that ankle over the opposite knee. Walk the heel out to the side and tilt it to the other side that you were just working on, to the opposite side. So go away from the side you were just working on. This will help to get a stretch right at the top of the hip part. So the bony part of the hip that we are working on with the ball, it'll help to get a stretch right there. Just really breathe here. Again, use pillows on the side of your knee if you need a little bit more support. Now grab the back of the knee and pull it. So the outer side of the knee, pull it towards your chest. This will get a deeper stretch into the hip, but if this is too much for you, then just hold the previous stretch that we were working on a little bit longer. And recover. So now walk the heel back towards the center. And let's work on the other side. So grab that tennis ball, find those pointy, bony parts of the side of the hip, and place that right beside your tailbone. Place the other hand on the tailbone to give you support. Straighten out the opposite leg, and let's gently let that bent knee fall out towards the side a little bit more every few seconds. A little bit more. A little bit more. A little bit more. And back to center, and just let it fall back out to the side and then back to center. Out to the side, back to center. Again and back. Out, in, out, in, out, in. We move the ball a little bit more to the outside and let your knee just gently fall more and more every few seconds. Move the knee in and out. 1, 2. 1, 2. So just keep up with that rhythm. And move the ball a little bit more to the side towards that bony part of your hip. Same thing, let that knee gently fall a little bit more every few seconds. Good, bring the knee back up, cross over and let it fall out. Same rhythm, 1, 2. 1, 2. 1, 2. Keep up the rhythm. Don't forget to breathe. And slide that ball a little bit more. We're going to have our knee a little bit more out to the side and pulse it here. 1, 2, 3, 4. Keep up the rhythm. The ball should be just behind that pointy part of that hip. Now just release it, relax it, ease into that release. Good, and recover, and now move the ball a little bit more, really almost right behind that sit bone area, and pulse your knee. 1, 2, 3, 4, 5. Keep up the rhythm. And let it rest out to the side. And back to center. Remove the ball, cross that ankle over the knee, walk out the opposite heel, and rotate towards the heel you just walked out. Make sure you're pressing your knee away from you. Don't forget to breathe. In through your nose, out through your mouth. With every exhale, the stretch becomes a little bit easier. Now pull the outside of that knee, pull the knee towards you. Nice and gentle stretch. And now keep the knee pulled towards you. In just a couple moments, we're going to recover from this position. So keep breathing here. I'm beginning to slowly even rotate more and more. Now walk everything back to center. And sit up, and we're going to cross that same side that we were working on, that leg right over top, and twist towards that leg. So you're going to feel a nice stretch. Make sure you're keeping your back nice and straight. Use your arm for support to keep your back nice and straight as you're twisting into the side that you're working on. You're making sure you're inhaling and exhaling. And now let's switch sides. Keep your back as straight as you can. Use your arm for support. Inhale and exhale. Every time you exhale, you're getting deeper and deeper into the stretch. Now unravel yourself, and we're going to go into child's pose, but add a little bit of a variation here because we're going to also work on a technique to open up the hips and open up the SI joints. So you're just going to squeeze one glute at a time and just try to gently rock your hips back and forth, then go onto all fours, put an arch in the low back, and go back to child's pose and repeat. So side to side, nice gentle work each side, and all fours, arching your low back, and back into child's pose. Side to side, squeeze your glutes one at a time, arch in the back. Good. So we're just really making sure the whole lower part is really becoming mobilized. It's attracting a lot of blood flow. And the ligaments and the muscles are becoming more and more elastic. So keep repeating this pattern. Again, onto all fours, arch the lower part of your back, and sit back into child's pose. And side to side, on all fours, arch the low back, and child's pose again. Side to side, on all fours, arch the low back, child's pose. Side to side, fours, arch low back, and good. Now grab that elastic band. We're going to place both our feet inside it and place the band right above our knees or below our knees. I'm placing mine just below, but placing the band a little bit over to spread out the surface area. You're going to squeeze your glutes to open the elastic nice and slow, holding it, and then slowly controlling the elastic band as you bring your knees closer together. So essentially, we're never taking tension off the band. So squeeze your glutes, pull out 4, 5 seconds, hold for 5, 4, 3, 2, 1, and then slowly recover, but maintaining tension on the band. And again, squeezing out, 3, 2, 1, hold for 5, 4, 3, 2, 1, and recover for 5. Never let the tension off. Squeeze the glutes, open everything up, squeeze, 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 hold, hold, hold. Slowly let the knees come back together, but do not let them touch. Do not take tension out of the band. So continue these patterns, squeeze, open up. What we're doing is we're attracting blood flow to the area, but contracting the muscles so much, we're actually limiting the amount of blood that's allowed to go in the area. So then once we release, so now bring your knees back together. Once we release and completely take the tension off the muscles, again, open your knees, then that will send a massive rush of blood to the area, which is what we want. So we're really working the piriformis, we're working the glute med muscles, and we're trying to reestablish stability. So now Place that towel we were using before between the knees because we're going to squeeze our knees together. Bring your heels together as well. So squeeze, 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 squeeze. Keep squeezing, keep squeezing, keep squeezing, and release. Don't let the towel fall though. Take a bit of a break. We're going to do it again and squeeze. Try to squeeze it as much as you can. What we're doing here is we're trying to just reset the alignment and relax. And squeeze, everything squeeze, 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 and release. And squeeze, 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 squeeze as much as you can. Obviously without hurting yourself. You don't want to go more than a 7 out of 10 and release. And squeeze the towel. Keep squeezing, keep squeezing, keep squeezing. And release. Once again, squeeze the towel. Squeeze, 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 squeeze. And release. And squeeze, squeeze the towel. Squeeze the towel. Keep squeezing, 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 and release. Good. Now remove the elastic band, remove the towel. And we're going to work on balancing to strengthen that glute med muscle. So find those pointy parts of your hip. You want to keep them right aligned. So when you take your foot off, they're completely aligned. So you're not lifting up and you're not lifting down. You might want to do this in front of a mirror. You're keeping those pointy parts right in line with each other. So we're going to hold about a minute each. And then we're even going to try to concentrate on making sure the pressure that we're placing on our feet with our body weight is equal. Or are you too much on the outside of your foot? Are you too much on the inside? Are you too much on the heel? Are you too much on the toes? Try to make sure your weight is distributed equally right in the center of your foot. We're going to perform a technique called the clock. So you touched 12, 11, 10, now 9, 8, 7, 6, 5, try to go all the way around, 4, 3, 2, and 1. And really try to keep things centered. Now let's go on to the other side and do the same thing. Really establish that equalization first. Don't allow your hips to drop or go above the other side that you're standing on. Really hold everything nice and strong. Keep things stabilized. It's normal to feel a little bit of a burn if you're weak or get too tired. So if you need to take a little bit of a break because it's just too much, and just do what you can. And same thing with the feet. Try to get that focus on the middle part. Now let's go 1 and 2. Keep your hips nice and steady. 3, 4, 5. Oh, I missed one. 6, 7. Try as best you can to keep your hips nice and straight. 9, 10, 11, and 12. That's all we have today for the video. I want to thank you for taking time to try this out. I know if you keep up with this, this will be very effective for you. If you know anybody else in your life who's suffering from the same thing, share this video with them because it probably will work for them as well. Please subscribe to my channel as well, and please like it because it just helps with the YouTube algorithm. And when you subscribe, you'll be one of the first to be notified of any other new videos I release in the future. If you want to see any specific videos from me, leave your suggestions below in the comments. Thanks for all your support.